Welcome to You and Your Pets. I'm Jim Horton. We're here with our resident expert, Dr. Ernest Rogers, and we're going to discuss a range of pet issues, pet health tonight. What we're going to focus on this time is emergency medicine and critical care. And would Dr. Rogers, would you introduce our guest?
I'd be happy to. Thank you very much, Mr. Horton. Tonight we are very fortunate to have an emergency clinician, Dr. Deming, who is actually a general practitioner who's decided to specialize or work her way through emergency medicine, and that's limited her practice to emergency medicine in small animals. And Dr. Deming, can you tell us a little bit about how you got into this, what your education is? And
Sure. I went to my undergrad at University of Maryland, and I knew I wanted to be a veterinarian, but I didn't really know more than that. I thought for some time I wanted to work on exotic animals and zoo species, and when I went to vet school, I didn't really know at that point. So I graduated from University of Maryland in 1997, and then I attended University of Florida in Gainesville for veterinary school, and I graduated there in 2001. And from there, I still didn't know exactly what I wanted to do. So I had applied for an internship program, and I received one of those, and I moved to New Jersey, and I did my internship at Garden State Veterinary Specialists in Tinton Falls. And that was a rotating internship, so that means that I worked with specialists in different areas. So I had some time where I worked with surgeons, other time where I worked with internal medicine specialists. But a lot of the work during the internship was in emergency medicine, and sometimes with specialists and other times just after hours late at night.
by yourself?
By myself.
Yeah.
Although I actually often had experienced emergency doctor there, not a specialist, but somebody to run ideas by and ask questions.
Right. So I don't know, when I was doing emergency medicine, we used to say that it was hours and hours of boredom with minutes of intense anxiety and stress. And is that what you found?
Yes, definitely at the beginning, especially when I wasn't used to, all of the variety of cases and problems that pets could walk in the door with.
Right.
And it's hit or miss. I mean, on a given night, you may see no emergency cases whatsoever. And on other nights, you might have three dogs hit by a car walk in at once, or be carried in at once at that point. But yeah, you never really know. And I think that's one of the things I really like about emergency medicine is that I get to see such a variety.
Right.
Well, that brings up an issue. When would a pet owner be referred to you rather than being referred to Dr. Rogers? In a normal day, would not someone take an injured animal to Dr. Rogers first, or would Dr. Rogers say, on occasion, take this animal immediately to an emergency? How does that work? What is the routine there?
I think you would get both situations. So certainly for one of Dr. Rogers' regular clients, they would be most comfortable going to Dr. Rogers for any medical problem, and if it's during his normal hours when he's in the office, that might be just fine.
Go ahead.
A lot of the emergencies I see are not life-threatening emergencies necessarily.
Right.
So
a lot of times, if I feel that a case is something that has to be monitored, I will refer them to the emergency clinic without them even coming in. A hit by car, even though I can treat the initial issues, the animal should be monitored for 48 or 24 hours, and so I'd refer them to Dr. Deming. And obviously, I like to go home at night and sleep all night, which 40 years ago or even 20 years ago, veterinarians couldn't do. They had rotating emergency shifts. And now with the advent of veterinary emergency, and particularly the Westfield Veterinary Group that has the emergency department, of which Claire is Dr. Deming is the head, now I can go to sleep at night and they refer to Dr. Deming. So that's one of the big issues.
So what kind of a lifestyle do you lead that you are awake all night? What is your schedule? When do you go on duty? When do you come off duty?
So I'm more of a night person. I'm not a morning person, so it works out well. My hours, I go in most days at 8 o'clock in the evening, and then I work all night, and I go home around 9 a.m.
Oh my gosh.
So it's a long night, but it works out for me. And there are definitely emergency doctors and hospitals, though, where there are daytime shifts, and on occasion I do go in at 2 p.m. in the afternoon and, cover some other hours, so.
So you're working pretty much solo then, is that not correct? If you need to consult with someone, how does that work? Do you just wake somebody up at home, or?
Oh. At
Not me.
times. Right, not Dr. Rogers, certainly, but not often. When I first started out, though, as an intern and as a less experienced emergency doctor, there definitely were backups in place where I could call in a surgeon if it was a more complicated case and I needed another pair of hands to go in and do the surgery, while I had other emergency patients to attend to. And, right now I'm not by myself. I have a very dedicated and excellent nursing staff, my veterinary technicians, that are there with me to assist me with everything from answering the phone and filling prescriptions to anesthesia monitoring and surgery.
Right.
So.
Okay. That raises an issue. How does other than injury, which is pretty obvious, if your animal gets severely injured, you have to do something right away. But if the animal is not injured but doesn't seem right and it's 10 o'clock at night,
Mm-hmm.
well, first of all, what should a pet owner be looking for? And with an animal, I mean, they can't talk, they can't complain.
Right.
Either you know or you don't know the animal well enough to figure out that something isn't working right. What does the pet owner look for? What do they do?
Oh, there are so many different signs that could constitute an emergency, and some of them are a little more obvious than others. Bleeding from anywhere. The most common thing that I probably see pets for is vomiting and diarrhea, which may not be an emergency, but
Right.
if you see blood coming out of somewhere,
Right.
you should definitely bring your pet in.
Difficulty breathing.
That was going to be the next thing I mentioned. Yes, any sort of labored breathing, difficulty breathing. And again, it may be something as simple as an upper respiratory infection. It may not be life-threatening, but at home, a lot of times my clients, they just don't know.
Right.
I would definitely rather have you at least make a phone call and
Right.
talk to somebody on the staff about whether you should come in or not. And, we can try to give you some guidelines. And if you're ever just not comfortable and you want to bring your pet in, I'm much happier to see your pet
Right.
at 3 a.m. and have it be nothing serious than,
Right.
have it get overlooked
Right.
and have something, happen.
A lot of the times what I saw in emergency medicine was acute paralysis or very sudden, unexpected paralysis. Sometimes we see difficulties with eyes that all of a sudden seem to be worse, and they always seem to be worse around 8 o'clock at night, just as I'm closing up. But if you aren't sure, as Dr. Deming says, call the emergency clinic, discuss it with someone. And what I used to tell people, if you're concerned enough to give us a call and you're concerned enough to want to come in, we're happy to see you. Because a lot of times over the phone, we can't assess
Yeah.
what it is. And so if they come in and it's nothing, now they are spending a certain amount to see Dr. Deming, and they're upset with us because we couldn't diagnose it over the phone. And if it's something and they don't come in and the patient gets worse, then they're still upset. So we have to leave the actual decision to the owner, I think.
Yeah.
I'm assuming that as an emergency physician that one of the criteria for treatment is speed. Is that not correct? You have to act pretty quickly, diagnose quickly, and react quickly.
Yes. Definitely for some medical conditions, the timing is very important, very critical. One thing in particular that we were talking about what to watch for at home, what constitutes an emergency is large breed dogs get something called bloat. And it's a condition where the stomach fills up with gas and twists. And it's a matter of a few hours from when it starts to the pet being in a life-threatening condition. And it's something where even a few minutes can make a difference between that pet, being stable, or passing away before it can even get to me,
Right.
or before I can do anything. So.
What types of animals do you see? I'm assuming dogs and cats, but is there a full range? If someone has a parrot, would you?
Yes.
No kidding.
Mm-hmm.
So you, as an emergency physician, you have to be totally familiar with avian diseases as well?
Well, in terms of the emergency things, a lot of the emergencies can be very similar. With any sort of bleeding or trauma, for any species, the approach is kind of the same. Stop the bleeding and address whatever is broken. But yes, I see dogs and cats mainly, and I do see a fair number of other exotic pets like rabbits and ferrets, some guinea pigs, hamsters, But yes, even parrots, the occasional reptile, just anything that you can think of, really. So
Emergency medicine is really based on principles and not the specific issue that you have in front of you, but the principles that you use to address those issues. And so it's interesting.
yeah.
Well, as a matter of, in terms of the flow of cases, you said you may have nothing for several hours, then all of a sudden a whole group of emergencies will come in. Do you have any kind of a rhythm to your case flow during a year or months? Or is it it's just always, you never know what's going to happen on any given night?
Well, yes and no. So I never know what's going to happen on any given night, but there are times a year where we tend to see more patients in general and certain types of emergencies. So I tend to see more emergencies in general over the summer, the warmer months. People are outside with their pets, everybody's more active, and sometimes they get into trouble. So I see more trauma and more even minor injuries, lacerations, things that need stitches during the warmer months. And then I definitely see a lot more dogs that eat chocolate pretty much between Halloween and Valentine's Day.
Yeah, right.
So all through those months. So I
Right.
mean, more than one a night sometimes.
Pancreatitis.
Yes,
And
that
that's
as well.
a disease of the pancreas where an animal that eats too much fat may well have an inflammation of the pancreas, which can be painful in dogs and probably painful in cats, but it is also a life-threatening disease that we see. So
Yes.
they get into lots of things, including poisons, and I'm sure you've seen your share of poisons.
Right. I like to joke that if dogs didn't get into things and eat things that they shouldn't, I would have nothing to do.
Right.
Because, like I mentioned earlier, vomiting and diarrhea is probably the main symptom that pets come in for, cats as well, but a lot of it is dogs getting into things, eating something gross, eating something poisonous, chocolate, or even other toxins, pills, medications that people drop, or that they just decide for whatever reason are tasty that day. So
We have a dog that gets into chocolate. I don't know, it hasn't harmed him yet, but I don't know why it hasn't.
Well, I haven't seen
We have to take a
him.
break, I'm afraid, so we'll be right back. This is You and Your Pets. I'm Jim Horton with Dr. Ernest Rogers, and we will be right back.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
Welcome back to You and Your Pets. I'm Jim Horton here with Dr. Ernest Rogers, our resident expert. And Dr. Rogers, would you take over for this section to talk about the clinical approaches used in emergency medicine for pets?
Thank you very much. Dr. Deming is here with us, and I'll just repeat that she is with the Westfield Veterinary Group in the emergency department.
Yes.
And she's an emergency clinician who obviously works nights and some days and gives me a relief. So there's several things that come in emergency medicine, and this is, from my experience, one of the big things in emergency medicine is deciding if you have 5 cases that come in, you have to decide which case do I see first, which case do I see second, and which case do I see third. And there's a principle in all medicine called triage. And how do you go about triaging an animal that comes in that's been hit by a car and can't breathe versus an animal that maybe has gotten into chocolate versus an animal that has been vomiting for a day? How do you triage those or set them aside?
Well, as far as the initial evaluation, the triage portion, I really have to rely on the rest of my team. So my nursing staff, my veterinary technicians, they are typically the people who go up to greet the clients bringing in the pet, or even get the gurney to help carry the pet in the first place. Right. And they're trained to recognize the most common emergencies, and they have a pretty good feeling as to when a pet really needs to come right to the treatment area for oxygen or more immediate evaluation by the doctor.
Right.
And then there are definitely certain situations where, I've told them, I don't I don't know how the pet looks, but you should bring it back for me to look at
Right,
anyways.
right, right.
Any type of trauma like
Right.
a dog that's been hit by a car.
Right.
Um,
And so you sort of sort them out by criticality of injury or criticality of disease?
Partly. And then, there's also, the technicians will do a brief physical exam as far as finding the vitals on the pet, the temperature, the pulse.
Right.
They might take a cat in a carrier into an exam room because, you can't see how the cat looks until you
Right.
get it out of the carrier sometimes. They might take it out, put it on the table, and realize that
It's
it
done.
can't even stand up.
Right.
And at that point, they might check its heart rate very quickly and then make that decision that it needs to come
Right.
to see me before a dog with a bleeding toenail.
Right,
That
right.
is jumping around the room and, licking them.
Right.
So,
And unfortunately, the way triage works, at least in the military aspect, is you have those that really don't need your help immediately, those for which there's basically nothing you can do, they're going to succumb to their injuries, and no matter how much you work, they're likely to succumb to their injuries. And then the middle third is what you really want to get on, and those are the ones that need your help immediately to overcome whatever challenges they have.
yes.
And so triage is what Dr. Deming does and what she does with her team, and that's very important. It is a team
Definitely.
teamwork.
Yes.
So tell me about some of the cases you've seen. We're going to see some pictures of this at the end, but
Okay.
some of the more exciting things that you've seen in terms of clinical work. Anything really exciting? Have you found something stuck in a dog that you didn't expect?
I've taken a lot of different objects out of dogs because they eat things.
Labs.
A lot of Labradors, a lot of Beagles. They're usually the worst offenders. But, I do like surgery, so I get to do a lot of that on emergency.
Right.
And, the exotic species as well, like we mentioned. I get to see some interesting critters.
Right.
So.
Makes it exciting, doesn't it?
It does.
Doesn't
And
it?
I never know what's going to walk in the door.
Right. So it sounds like you really depend on your team, your technicians team, your nursing team, and your front office team.
Yes.
And so how do you interact with them? Are they, as you say, they do the initial evaluation and then they come back and they see you? Or, I mean, when I'm a clinician and I'm in bed, I have no idea what's happening to my clients, but I know they're getting good treatment. And so what should a client expect if he walks into your hospital and says, my dog's just been hit by a car? What should he expect in terms of the flow of being examined?
Yes. So for something like that where a pet is potentially in more serious condition, like being hit by a car, we usually do need to take the pet and bring it to our triage area, our main treatment area, where we can administer oxygen and start an IV, treat for shock, administer pain medication, that sort of thing. So unfortunately, we do have to often take the pet away from the client to start with, so that we can work on the pet. If the pet is not in quite a serious condition, then the technician would usually go and find out why the pet is there, talk to the client a little bit, get some initial vitals on the pet, and then they would just let me know that they're there and what was going on, and I would get, as soon as I had a chance, I would get into the exam room and take a look at the pet and talk about what might be going on, what tests we would recommend running, and what the possible treatments could be.
And so it sounds like an exciting time of night when you get all those things coming in.
Well, yes, and it is, and I may be jumping between 3 or 4 different sets of pets and clients at any
Right.
given time too. So,
Right. One of the things I noticed about emergency medicine is that you see a case, you fix a case, you send it on, and it's nice. You don't necessarily have to follow it for 2 months. Is that
Right.
what you find?
right, I do like emergency medicine because I like to take care of things where I can fix them or not pretty quickly.
Right.
I just like it to be sometimes clear cut.
Right.
It's bleeding and I can stop that.
Right.
Or there's something wrong with the eye and I can look at it and say it needs this medicine.
Right.
And then for the follow up, then I would send them back to you.
Right. Right.
For other recommendations for more long term care.
Right. And that's interesting. So one of the big things that I was trying to bring out was the fact that we have teamwork. And I know that at least in my hospital, we have people who work with me, and I know you have people who work with you. And so
Yes.
let's just go to some of the things that we'll see, some of the equipment that you might use that maybe is a little bit different than what I typically use. So
Right.
typically our first picture is of you and a cat that is getting oxygen, but realistically, it shows the teamwork. It shows how your technician, what's his name?
That's Rob.
Rob, who's assisting you in working with this cat.
Yes.
No one as a veterinarian works alone.
Correct. And even in that photo, I have another team member who's taking the picture. So in a lot of situations, I mean, there might be 3 people, 4 people working on one pet because in a life-threatening emergency, there's a lot of things that should be happening all at the same time.
Right.
So as the doctor, I'm going to be trying to fit in there and evaluate the pet to direct the treatment. But my technicians know, give some oxygen, start prepping for an IV. They're already on top of a lot of the things, and then I just sort of nudge them in different directions.
Right.
And as soon as I can safely break away, I'll go speak to the client about what's going on as well.
Or go on to the next case.
So, yes.
Can I ask just briefly, how many people are on staff overnight in your particular hospital? Because it sounds like you have 5 or so people that work overnight.
Anywhere from 2 to 5, depending on the night and the hour.
Right.
Oh
So-
my, yeah,
Yeah.
okay.
Weekends are worse than weekdays, and Mondays and Tuesdays tend not to be as bad as Thursdays and Fridays.
Right. And I also have inpatients. It's not just the emergencies that are coming in the door. I have patients that have been hospitalized during the day or the previous night that are still receiving ongoing care.
Right.
So,
And that's one thing that we should bring up, that it's really emergency and critical care. So that's why if I have a patient that I know I can't keep overnight because I'm not going to be there, I will send it to Dr. Deming for critical care or monitoring over the night, and that's part of what critical care is.
Okay.
So there is a specialty designation, and there are emergency veterinarians who go through a 4-year residency and then are specialized. And there are also people who are interested in it and belong to the committee, but are not necessarily specialized, but do equally as good a job. So this is the first one that we have, and then the second one is another teamwork, but this is actually showing a cat getting an asthma treatment, and we use albuterol and we use steroids that
yes.
can be sprayed as a human would take them, but why don't you just describe what's going on here?
Sure. So dogs and cats don't cooperate to take an inhaler. So we do see asthma in cats, and that's one of those things that might be going on if your cat has labored breathing. So we have this specialized chamber that it's similar to what I believe they use for human infants
Right.
that can't inhale on something like that. So the inhaler fills the chamber, and then if you can convince the cat to put the mask on their face, they will sit there and breathe in the drug. So it's not always as easy as it might sound, but and this cat is not being particularly cooperative. But
Well, it is in a still picture.
no, it's not. He's also not really asthmatic. We were just taking the picture, so he was fine.
And shows another piece of equipment that you might use, and I'm sure you're well versed in this. This is the ultrasound.
Yes.
And so it's mostly used when you have abdominal issues.
Yes. And actually, I just had a dog last night that was hit by a car. And one of the concerns with any sort of trauma is internal bleeding. So that's mostly what I'm using the ultrasound for in the emergency setting, is to check for internal bleeding in the abdomen, in the belly.
Right.
To know how sick that pet is and what other things I need to monitor. So.
Okay. So this is your oxygen chamber where I
Yes.
guess you put animals that are having difficulty breathing.
Yes, so this, it's a specialized cage. It lets us give them additional oxygen without having to potentially cause stress by holding them like the cat.
Right. Then you have a crash cart, and everyone knows about this, that it happens in human hospitals, and they often talk about, bring the crash cart, he's crashing, he's crashing. And so the emergency clinic actually has that.
Yes.
And it contains all the different ingredients necessary to treat cardiac.
Any immediately life-threatening condition, it has everything I would need without having to run even 10 feet across the hospital to grab an additional drug or needle or catheter. So everything's in one place.
And then this is one of the drawers in the crash cart that contains some respiratory equipment. That big green thing is
Yes.
a...
It's an ambu bag, and that's for administering oxygen, although it's not usually the first thing I grab. We have other ways that are already set up that are right there. But there's also some IV fluids, some specialized fluids to treat for shock.
And this is a tracheotomy.
Yes, this is, if you have a dog or cat that is having trouble breathing, their throat is swollen, or there's some sort of obstruction, this is a surgically placed tracheotomy to give them an airway.
So I'm just going to go quickly ahead to one of your little patients. And this is one of your little patients, a little tiny beagle?
Mix,
And
I don't know.
Just quickly, what was wrong with him and what did you do for him?
Oh, this is Ross. He was a tiny, tiny puppy, and he had parvovirus, which is a very contagious virus, and it causes vomiting and diarrhea and bloody diarrhea. And he was actually very sick. He was in the hospital for about 2 weeks. And in that photo, he's receiving a blood transfusion.
And he did okay?
And he ultimately did okay, and he went home with one of our technicians.
Fantastic.
So.
Mr. Horton, please.
Thank you very much, Dr. Claire Deming, for the time you spent with us this evening.
You're welcome. Thank you for having me on.
Well, thank you. And this is You and Your Pets. I'm Jim Horton with Dr. Ernest Rogers, our resident expert. Thank you very much for watching.